Hello, my name is Diane, and I will be beginning the presentation. Today we'll be presenting differentiation between bottle feeding and breastfeeding, and I'll be presenting with my partners, Amanjeet, Demi, and Marina.
In the next few minutes, we're going to be talking about pathophysiological changes, indicators of breastfeeding and bottle feeding, contraindications of breastfeeding and bottle feeding, trends and issues, advantages and disadvantages of breastfeeding and bottle feeding, and conclusion. Pathophysiological changes.
First, we will go through the pathological changes that a woman goes through during, before, and after birth. So, the mother will go through body changes, specifically her breast tissue. There are specifically two hormones that help with milk production, which are called prolactin and oxytocin. Prolactin is secreted during pregnancy, and it helps with the growth of the mammary tissue to prepare for milk production. However, the milk is not produced because estrogen and progesterone is present in the body, thus blocking the full potential of prolactin. After birth, estrogen and progesterone levels decrease, thus allowing the prolactin to encourage milk production, even while the baby is suckling the breast. Prolactin is increased in the body, thus promoting more milk production. The more the baby suckles, the more prolactin is released, resulting in adequate milk supply for the baby. Oxytocin is released in large quantities during birth and while the nipple is being stimulated by the infant. Oxytocin also stimulates the uterine muscles to contract and can also be used artificially to induce labor. Breastfeeding, oxytocin can cause the breast muscles to contract, thus squeezing milk through the ducts as the infant continues to feed.
Indicators of breastfeeding and bottle feeding.
Now we shall do indicators of breastfeeding and bottle feeding. So for breastfeeding, it's the most preferred method of nourishing the infant as it provides all the essential nutrients for the infant to thrive, such as carbohydrates and proteins. It is also the preferred method of bonding with the baby during feeding times. Breastfeeding will occur right after giving birth, and the mother may even experience lactation during the pregnancy, but breastfeeding would usually occur as soon as the baby begins to suckle the breast. Bottle feeding is used when a mother is unable to produce milk, an infant is unable to latch, or for the mother's own personal reasons, such as going back to work full-time, or because of soreness of the nipples that can possibly occur. Or the mother can even pump her own breast milk to bottle feed the infant with. It all depends on circumstances and their preferences. Another option is formula, which is still beneficial to the baby and filled with the required nutrients to sustain the infant.
Contraindications of breastfeeding and bottle feeding.
Contraindications of breastfeeding. Human milk includes the most complete form of nutrition for infants, including premature and sick newborns. However, there are few instances where human milk or breastfeeding is not advised. Breastfeeding is completely contraindicated if the mother is infected with HIV. Also, if the mother is infected with human T-cell lymphotropic virus type 1 or type 2, these viruses can transmit into breast milk and cause certain type of cancers. If the mother is infected with Ebola virus, breastfeeding should be stopped. When a breastfeeding mother is using illegal street drugs such as PCP or cocaine, it is not safe to breastfeed as these drugs can pass through mother's blood into the breast milk. Breastfeeding is temporarily contraindicated if the mother has untreated brucellosis. It is an infectious bacterial disease which people can contract if they come into contact with infected animals. If the mother is on certain medications, alcohol, tobacco, breastfeeding should be temporarily stopped. The use of certain medications need the consultation of a physician before breastfeeding. Breastfeeding should not be done temporarily if the mother has been vaccinated with smallpox or yellow fever vaccine. There are few instances of transmitting virus to the baby after the vaccination. Contraindications of bottle feeding. The bottle must be fully disinfected and sanitized before preparation and feeding. Never reuse a bottle twice before cleaning or disinfecting it properly. Do not put the bottle nipple in your mouth to check the temperature or clean it. This can spread germs to your baby. Also, the formula should not be microwaved. Microwaves heat the liquids unevenly, resulting in hot spots. This can cause your baby's mouth to burn. Instead, warm the milk in a container of warm water.
Trends and issues. Bottle, breast, and education. In a study completed over the course of almost 2 decades, from 2000 to 2019, the International Center of Equity and Health studied the trends of breastfeeding versus bottle/formula feeding in relation to education status in 81 different countries around the world. Note that these observations were made alongside WHO's definition of breastfeeding. The study found that early initiation of breastfeeding and exclusive breastfeeding over the course of 6 months after birth have increased over the past 2 decades, regardless of educational background. Furthermore, women of lower or no formal educational background were most likely to initiate early breastfeeding, as well as exclusively breastfeed for at least 6 months after birth. Inversely, women with higher formal education were most likely to bottle/formula feed within the first 6 months after birth. The upward trend in breastfeeding is encouraging and is increasingly aligned with the global nutritional goals that are endorsed by the World Health Assembly. Breastfeeding versus machine. Some of you may be thinking, what machine is working against breastfeeding? I'll be real with you and say it's only a literal machine depending on what job you work. I'm talking about jobs, the economy, and working mothers. Ideally, we want mothers to exclusively breastfeed for at least 6 months after birth. But that is not always possible with the obligation of work. With the increased financial pressures of starting a family, it can be hard for women to find time to breastfeed while also dealing with the need to work. Because of this, formula and bottle feeding can be more convenient for mothers that may feel overwhelmed or do not have time due to work. We must also keep in mind that women from different countries, such as the United States, are not guaranteed maternity leave and must return to work before those 6 months are done.
Advantages and disadvantages of breastfeeding and bottle feeding. Advantages and disadvantages of breastfeeding. What are some pros of breastfeeding? It includes perfect nutrition. Breast milk is the best possible nourishment for babies' development and growth. Each mother creates it specifically for a child. Breast milk is high in protein, carbs, fat, vitamins, and minerals, as well as being easy to digest. Also, protection. Breast milk contains all the nutrients, antibodies, hormones, and oxytocin that are required to boost the immune system of babies and protect them from a wide range of infection. Also, brain power. Breastfed babies perform better on IQ tests, according to research. They may even stay longer as adults and earn more money. Also, it's ready and portable. Breast milk is always fresh and at the proper temperature, and babies can feed whenever they're hungry. Also, it's good for mothers' health. Research shows that breastfeeding can protect mothers from diseases such as breast and ovarian cancer, diabetes, and heart disease. It also creates a special bond between the mom and the babe. Breastfeeding allows mother to feel closeness and build a close bond with the mother. It's also inexpensive. It promotes a healthy digestive tract and the infant's immunity. It lowers risk of postpartum depression, and mother retains iron due to not having the menstrual cycle while breastfeeding. Disadvantages of breastfeeding. This includes sore or cracked nipples. If the baby is not properly positioned or attached at the breast, the nipples can become pinched, resulting in sore or cracked nipples in the mother. Also, babies not getting enough milk. Due to poor attachment and positioning or other factors like stress, anxiety, depression, consumption of alcohol, tobacco can affect the production of milk in the mother. Also, breast engorgement. When the breast becomes overly full of milk, they could become hard, tight, painful during breastfeeding. Also, mother must be mindful of their intake. No alcohol or certain medication, and always cross-check your medications with your physician while breastfeeding. Also, must be readily available for the infant for feeding. Also, partner does not share feeding responsibility and miss out on bonding time, and it also causes metastasis. Advantages and disadvantages of bottle feeding. What are the pros of bottle feeding? It is convenient. No more dragging a pump and all its parts around home. No more looking for a pumping bra and no more time spent connected up to it. It only needs a couple of scoops of formula, some water, and a bottle to get started. It is filled with the important nutrient. When your child is on formula, you won't have to worry about giving them any extra vitamins, which physicians occasionally recommend for breastfed newborns. Most formulas are supplemented with iron and vitamin D. Also, you'll be aware of how many calories your baby is getting. It also comes soy-free and dairy-free in case of allergies. If your infant is allergic to dairy or soy, nursing necessitates a careful diet. The formula can be a lifesaver for mothers who are unable to do so. Formulas may be prepared in a way that helps newborn avoid allergic reaction. It also allows others to bond with your baby as well. It can be a great time to bond, with an added bonus for mom to get a break. The babe also stays fuller. The formula takes a bit longer for newborns to digest than breast milk. That might mean they'll be fuller for longer and won't have to eat as frequently. Mom will get more rest if there's a long time between feedings. Also, it's easier for working moms. Formula feeding relieves a lot of stress for women who can't or doesn't want to deal with any of that. Also, share feeding responsibilities with partners. What are some disadvantages of bottle feeding? This includes the right temperature. The milk and the bottle should be at appropriate temperature for baby, and this might take time to prepare. Also, it leads to infant mortality. Also, it causes obesity and metabolic disease. According to research, infants who are fed with formula are more likely to become obese or develop type 2 diabetes. Also, it's expensive. Bottles, formula, rubber nipples, and breast pumps can all be expensive to buy. It also causes gastrointestinal infection. Formula-fed infants are more likely to get gastrointestinal disease and diarrhea. Bottles that have not been properly cleaned can cause additional issues. It can also make the mom feel as they failed when they are unable to produce or breastfeed. It can also create lack of bonding time during feeding. Conclusion. How does this all relate to the PN conceptual framework? This includes providing holistic care and placing your client as the center of the care. Also being aware and communicating the advantages and disadvantages of breastfeeding and bottle feeding while making your client an active participant of their care. Also, using the standards of practice. Now that we're done this presentation, we have a case study. The question states, am I in the wrong for being honest with my wife that I'm disappointed in her for choosing not to breastfeed? Please take a few minutes to read the story, then answer the following questions. What are the social factors you will consider if the wife was your client? What education will you prioritize for the wife? What education will you prioritize for the husband? And what will be your recommendation for the couple to move forward? Feel free to leave your answers in the comment below. Wait, not yet. Please find link 1 below to test your knowledge about this presentation. Evaluation and additional resources. Link 2. Please find the Google form at the bottom to rate this presentation. Also, link 3 is an additional resources if you want to know more about breastfeeding and bottle feeding.